Dental implants are really the foundation for a new tooth or teeth. In a situation where one tooth has failed, you can use some kind of removable device, which most people find objectionable and not very satisfactory. You can use some kind of a fixed bridge, which would require preparation of the teeth on either side. And that bridge, that three-tooth structure, often the life expectancy is maybe 7 to 10 years. So if you have a one-tooth problem, it makes most sense to do a one-tooth solution. So it's easy to remove the tooth if it still is there, place the implant, place a nice fixed temporary on that implant the same day, and then restore it in due time. So in our dental implant seminars that we have for the public, there's a general consensus that the actual procedure of a dental implant is a painful process to go through. And I actually joke to the attendees often about, I know you're not going to believe me, but it is not a painful procedure to go through. And it is not what you would consider to be an interruption in your daily lifestyle to have an implant done or several implants done. So it's only after they have actually had the procedure that I see them as a follow-up that they go, okay, so I didn't have any pain. I believe you. But yeah, I realize nobody wants dental implants. They want a smile. And that's what they want. So if I can just get one word out to people, is that it is not a difficult procedure to go through. That would be it.